Bangladesh, a small country bordered by India, Myanmar, and the Bay of Bengal. The country is plagued by hunger, poverty, and natural disasters, with poor health and education facilities. It is the 8th most populated country in the world. Bangladesh emerged on the world map in 1971 as an independent nation following a civil war. Reverend Paul Munshi founded CSS in 1972, right after the Liberation War, to empower the war victims to make them self-reliant. He worked tirelessly to improve their standard of living. His mission continues today under the leadership of his son, Mark Munshi. CSS serves the poor and vulnerable by providing education, healthcare, as well as promoting women's empowerment through the economic development in the remote regions of Bangladesh. Children. So many children, deprived of the basic needs of life. We are trying our best, but still there are many who need our help, love, and care. The children are brought in by CSS through a comprehensive model to help build their lives step by step. Hope Non-Formal Pre-Primary School is providing a friendly environment where children start their educational life through games and activities. In the next stage, primary and secondary school-going children receive regular health services, educational materials and scholarships, along with education through community-based education program, and weaker students are given extra tutoring. Another CSS initiative is the Home of Blessings. It provides quality education, healthcare, food, and housing for poor, vulnerable, and orphaned girls. It allows them to grow up with dignity and great moral teaching. Reverend Paul's High School is another project of education sector. Through knowledge, technical skills, and self-reliance, this school is working towards illuminating the lives of those less fortunate and helping children. Along with formal education and leadership training program, every student is trained in character development. It teaches them to become humane, honest, hardworking, modest, punctual, and sincere.
I come from a very poor family. One day, my mother brought me to CSS Home of Blessings, where I completed my education and later received leadership training. Now, I am working as a matron at the Home of Blessings. If CSS hadn't supported me, I could never have reached my dream.
Today, a large number of Bengali youth have been deprived of education and employment. We believe that sustainable development of this country is possible by engaging the youth in employment. CSS, Hope Technical Institute, and Hope Polytechnic Institute are providing hands-on vocational training, producing a skilled and competent younger workforce. Skilled young men and women graduating from these technical institutes find employment in various organizations across the country through our job and business services. And also, by initiating their own income-generating activities, these youth are contributing to national development.
We would like to appoint some young and energetic technicians from CSS in our industry.
In Bangladesh, the available doctors, nurses, healthcare centers, and hospitals cannot meet the medical needs of the millions of people. In this river and forest-bound land, pregnant women are at the highest risk of being neglected as healthcare facilities are few and far away. CSS is committed to reaching out to these highly deserving and vulnerable women. Rural health centers are playing a vital role in ensuring healthier lives for the poverty-stricken, people of the remotest areas, especially for the mothers and children. Through these health centers, inexpensive testing, quality medicine, and reproductive health services are now within the reach of people. We are raising awareness among the rural families about safe motherhood through advocacy. With the help of CSS, basic health care and the quality of life have improved, decreasing maternal and child deaths. Health Alliance Bangladesh is a platform led by CSS to draw attention and open discussion with the national policymakers about the existing problems. CSS continues its efforts on HIV and AIDS prevention. It is a serious public health hazard, and the majority of its victims are sex workers. Bania Shanta is an old brothel located in the remote region of Mongla. HIV and AIDS Rehabilitation Project strives towards the improvement of the health and livelihood of the brothel-based sex workers.
In 2008, a number of sex workers, including myself, were taken from Bania Shanta by CSS for our rehabilitation. We received training on health and many other related issues. Each of us received a piece of land and a house. Even job opportunities were available to us. Our daughters are getting education at Home of Blessings. We have been restored to a place of respect in society. But there remain a large number of sex workers in towns and villages and wish to get rehabilitation care, like me.
HIV and AIDS prevention program has been providing STD healthcare facilities through drop-in centers for floating sex workers across the city. Access to clean water is a basic need. Yet, for many reasons, people are facing a crisis in drinking water. To solve the problem, CSS is providing safe drinking water and sanitary latrines. We are also raising awareness of health and hygiene through the Water, Sanitation, and Hygiene Project. Reverend Abdul Wadud Memorial Hospital in Khulna provides easy access to health services to the poor and vulnerable people. Every day, a large number of patients from the remote areas visit the hospital to receive low-cost, quality services. Free treatment is provided to the poorest of the poor. Moreover, to cater to the needs of the people in this region, different types of healthcare camps are organized by the hospital. To deliver healthcare services, skilled workers and nurses are needed. With that target in mind, a nursing institute was established. Every year, this institution graduates a number of skilled nurses. Since 1972, immediately after the Liberation War of Bangladesh, CSS has been working tirelessly to improve the lives of the people of this country. We began with relief effort and later introduced a microcredit program. The microcredit is based on availability of work and individual aptitude. Subsequently, the program has been expanding throughout many regions. The program is introduced as a skills-based training program that targets various income-generating activities. Many benefited by this program and have become socially and economically established. Seasonal loan on agriculture. Seasonal loan on fisheries. House loan. Microcredit. Small-scale entrepreneur development loan.
I took a loan from CSS microcredit program and started my business. Now, I am self-reliant. I'm doing my business with my own capital. 5 men are working with me. I am grateful to CSS.
Empowering Women, Improving Country is a project that trains unskilled rural women and after training, helps these women to get loans from microcredit programs so that they can start their own business and thus they are empowered both socially and economically. The environment is in great danger. Lack of awareness and greed is causing environmental pollution. Due to global warming and related climate change, the sea level is rising, and it has become a risk factor for us as our country lies just above the sea level. Our measures for disaster management have come to great help to the people during natural disasters like the tidal waves and Hurricane Aysha, which caused huge loss of human lives and property in Southwest region. Disaster management and climate change issues are priority areas for CSS, especially in rebuilding disaster-affected areas. If we fail to take effective and realistic steps in disaster management right now, food security, safe water, lives and livelihood, including our natural environment, will be at great risk. The AVA Center has become a popular venue for seminars, conferences, training, and other social events. Government and non-government organizations use this venue on a rental basis. By using the profits of AVA Center and the Fisheries Project, CSS has been implementing a number of development projects. Of these, HIV/AIDS prevention and rehabilitation project is mentionable.
Education is the most powerful tool to change the individual and impact family, society, and the nation. For this reason, we put a great emphasis on education. We aim to provide educational opportunity to all, especially to the orphan and poor children. The needs in Bangladesh are great, but with your help, we can bring hope to more individuals and transform lives and nations. One of the basic human needs is good health. Quality healthcare services are in short supply in Bangladesh. We are starving and succeeding in providing quality healthcare to poor and unprivileged people. The needs are far greater than what CSS is able to do. However, with your help, we can do more. Let me introduce Amana Begum. There was a time when she was in financial crisis, but she had a dream to become a business lady. CSS microcredit program helped her with a loan and training to fulfill her dream. As you can see, her dream became reality. As you can tell, they all need our help. I hope and pray that we all can smile like these children.